CBN's medical reporter Lori Johnson joins us now to unravel all of this. Welcome, Lori.
Nice to be here, Mark.
Yeah, we do need some clarification here. So many of our public health policies have been based on the idea that the asymptomatic transmission is very common. Why did this particular person say that it's very rare?
Well, she seemed to have been caught a little bit flat-footed. She said it was a bit of a surprise, and she sort of clarified her comments. She was making reference to some very small studies out of China that don't seem very reliable. So today, the WHO held a 45-minute news conference, which is posted to their social media outlets. They tried to quell the uproar created when Dr. Maria Van Kerkhove, who's with the organization's Emerging Diseases and Zoonosis unit, said asymptomatic transmission of COVID-19 was, quote, very rare. That statement created an uproar because of the mountain of scientific evidence suggesting otherwise. More importantly, the belief that asymptomatic people readily transmit the virus is why we closed our schools and much of our economy, because it's the idea that people can get infected and have no symptoms and then unknowingly pass it on to our most vulnerable, such as older family members. Today, Dr. Kerkhove said she was caught off guard yesterday and was only referring to 2 or 3 studies out of China that traced the contacts of a small number of asymptomatic COVID patients and didn't find much spread.
And so I was responding to a question at the press conference. I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know. And in that, I used the phrase very rare. And I think that that's misunderstanding to state that asymptomatic transmission globally is very rare. Some estimates of around 40% of transmission may be due to asymptomatic. But those are from models. And so I didn't include that in my answer yesterday, but wanted to make sure that I covered that here.
Another WHO official joined Dr. Kerkhove at today's news conference. Dr. Mike Ryan, the executive director of the emergencies program, also made sure to clarify the organization does not believe at this time that asymptomatic transmission is very rare, as was stated yesterday. Ryan said the exact percentage of asymptomatic people who transmit the virus is what he called a big open question, but that it's clear both symptomatic and asymptomatic individuals are part of the transmission cycle, as he put it.
And Lori, many might consider this quite a blunder for the World Health Organization, especially at a time when their credibility is being questioned by other things that the organization has said. Talk about that.
Yeah, actually, that's true. It was only a week and a half ago that President Trump announced that the U.S. is terminating its relationship with the WHO. That includes redirecting America's WHO funding to other public health organizations because of a failure to enact reforms over its handling of the coronavirus. The World Health Organization, as you may remember, dragged its feet on declaring a global pandemic, initially said the disease wasn't even easily transmitted person to person, and allegedly, in an effort to protect China, allowed the disease to spread. So WHO has a little bit of cleanup work to do.
Let's talk about these protests that are going on regarding the death of George Floyd. A lot of people in close proximity, we're talking thousands. Do experts think that we might see a spike in the number of coronavirus cases like in a couple weeks?
They actually do, and it's really great that you point out a couple of weeks, because we're seeing a spike in coronavirus cases now in some of these cities, and health officials are quick to point out that those spikes have nothing to do with the protests. More likely 2 weeks ago, Memorial Day. So we do want to see in a couple of weeks if we see a spike in cases from the protests. But remember, when we do see increases in cases, that's very different from hospitalizations, because we know that testing has really ramped up. And so when you have more testing, you're going to get more positive cases. That's very different from hospitalizations and, of course, deaths. So it's nothing necessarily to be alarmed about that we see increased cases, because that could be due also to increased testing. What we really want to keep a close eye on are those hospitalizations and, of course, deaths. And we hope and pray that those don't go up.
Amen to that. All right, Lori Johnson, thank you so much for your time today.
My pleasure.